Our 43-year-old patient is about 2 weeks out from surgery. She had a abdominoplasty, and she comes in today. She actually comes from quite a distance, 6 hours away, and she drove in this morning with her husband, and she's very graciously agreed to share some of her thoughts and feelings about how she's doing and how she feels about her results so far.
Amazing. I don't think I would have felt this good if I didn't have anybody except for Dr. Claytor.
That's very kind of you. So let's do a little bit of backstory. You reached out to me because of why?
I've had 5 C-sections. I had a lot of loose skin. I was not happy with the way that I looked, and I wanted to feel good. So I did some research. I knew I wanted drainless tummy tuck. So while I was Googling and looking for doctors that did drainless, by the grace of God, I came across your name and website, and I read a couple reviews, and I said, this is where we're going. I called the office. I had 2 consults in Buffalo. I wasn't super comfortable with the staff and the doctor. I don't know. And then I had called Dr. Claytor's office, and every single person that I talked to was so nice that I knew that this is where I wanted to go.
Well, I love it. And we definitely work very hard recruiting and keeping the best people who really know me and can share the experience. But I love that your journey to get here went through looking for other people, because I think that's appropriate and important for you to interview and talk to other physicians as you're looking for that one individual to help you achieve your goals. But share with us a little bit further, to the listeners who are tuning in, share with us a little bit further what some of your frustrations were leading up to this. What was going through your mind every day when you got up, you got dressed, and you went to work, in terms of your belly and how you felt?
Not being able to find clothes that fit me right. I feel like I was angry all the time.
It's okay. It's all right. She's getting a little bit emotional. It's okay.
Here, baby. It's okay.
It's okay.
I just feel like I wasn't a good mother or wife.
Oh, your husband's sitting right here, and he knows that's not true. But your experience is one that I have seen patients share frequently. And you worked out, you were dieting, you were doing all these things.
Nothing worked. I've tried everything.
What was the turning point to help you steer from status quo to action?
Having a supportive husband that said, this is what you want, let's go do it.
I love it. It's the unit, the team. What were some of the fears and apprehensions that you had as you made your first phone call?
I didn't really have apprehensions. I was so excited the whole entire time that I was actually going to go through with it and do it. My biggest fear was dying from doing an optional procedure and leaving my kids without a mother for something that I wanted, like being selfish.
Your fears and your frustrations are valid and understandable, and I take them very seriously, and I try to put together a plan that addresses those little hidden obstacles that can create that postoperative outcome that is not what we're shooting for. And one of the things that I do, as you are well acquainted with, is the protocol that I have for prophylaxis for any kind of blood clots. Share with everyone who's listening what that whole pathway was like for you.
As far as the Lovenox shots, I don't think you want.
It's okay. I know that your husband was dutiful in giving you the shots, and also I'll jump in. What she's getting at is the shots that we utilize, the Lovenox injections, were a little pinchy for you.
I don't like shots, but I needed to do it to not die.
Well, it's not that had you not done them, the outcome would have been
death.
Thank you, death. It's that we don't know which patients are going to be at this higher risk, and so I put this umbrella over you, and I find that it's very effective at giving prophylaxis against an unknown situation that this hidden corner.
Better be safe than
we
sorry.
just don't. Well, we'd like to say that, and you guys were great. You stayed in town for I think it was 4 days, and so I kept checking on you and making sure things looked good before I let you go back home.
Right.
And also we have a little binder on your abdomen to sort of hold everything snug. And I just find that, in my experience, it's been very helpful at minimizing these kinds of issues and concerns.
I had no issues, so it worked.
No, you did. You did well, and you're continuing to do well. And now we've pivoted in from your binder into the faja, and you went back to work at 2 weeks after.
I did. One day shy of 2 weeks.
It's pretty incredible. How is your activity level back at work?
I do have a desk job.
Yeah.
But I'm back to doing 100% what I was doing before.
And have your coworkers been supportive?
Absolutely.
That's fantastic.
100%.
That's awesome.
They were so excited for me.
And I'm excited for you too. And so here we are, we're 2 weeks, so we're still early, and you're a little bit of interstitial edema. There's certainly no signs of a seroma or any hematoma for that matter. Where are you in your journey in looking for changes in your wardrobe?
I've already gone shopping.
Oh, nice! Nice.
Yes,
awesome.
I have.
Awesome.
Yes.
Well, and don't buy everything, because your results are going to get even better as the interstitial edema settles in.
Okay.
So the last thing I always like to ask people is this something that you would recommend to a friend?
With Dr. Claytor, yes.
Well, thank you so much for your kind words, and we're going to continue following along until you're several months out from this procedure. But thank you so much for your kind words.
You're welcome.